Thanks for staying with us. There are different treatment options for someone who's been diagnosed with COPD. It's important for people with COPD to talk with their doctor about treatment options to make sure they find one that's right for them and succeeds in helping them breathe better. Becky Wozniak is still with us. Welcome back again, Becky.
Thank you.
So earlier in the show, we talked about treatment options before the break, and I'd like to get into some of those a little bit more. So first, if a doctor recommends pulmonary rehabilitation, what can a person expect?
Sure. Well, what they can expect to begin with is a full assessment. And this is going to be by a team of healthcare providers. And your team is going to include probably your family practice provider, a specialist such as a pulmonologist, which is a lung doctor. There's probably going to be respiratory therapists and even physical therapists to help with pulmonary rehab. We also can, there's going to be some testing because we want to reach patients where they are, and we don't want to, that's going to make their process easier for them. And we also will do something called a 6-minute walk test. And this is where we're going to have patients walk for 6 minutes. We're going to be testing their oxygen and their heart rate through that test so we can just see where their lung function is now, and then we can make goals for where we need to go.
All right, so a lot of assessment, then a plan is made. So can you talk some more about what exactly then happens during the actual pulmonary rehabilitation process?
Absolutely. So patients are going to get a lot of education in pulmonary rehabilitation. They're going to learn various breathing exercises. When you are short of breath, it can be very easy to let that breath get out of control, and then patients have very severe symptoms. And so we teach patients various breathing techniques, such as pursed lip breathing, breathing through pursed lips, almost like blowing out candles on a birthday cake, and taking slow, deep breaths in through their nose. This can help slow down their breathing and regain control of that breath when they start to feel a little bit out of control. So they'll learn breathing techniques. They're also just going to get more education on what COPD is and how to prevent it from progressing. And one of those big education points is lifestyle modification. And so if they currently are smoking, we're going to give them a lot of education and a lot of support to help them quit smoking. We're also going to do some nutritional counseling. We know that patients with COPD, we want them to maximize their nutrition and eat some healthier foods that might help decrease inflammation in their body. We also want them to get plenty of protein, just so that their nutritional status, their bodies themselves can help heal themselves. And we also know that when it's hard to breathe, it can sometimes be hard to eat. So we want to make sure that we can maximize nutrition with what they're able to intake.
How long would somebody with COPD continue with pulmonary rehabilitation then?
That's different for each patient. Most programs can be, several weeks long, and then we stop and reassess. We reassess how far they've come in pulmonary rehab and if there's things that we still need to work on. So that's a very individualized process.
Would you say that pulmonary rehabilitation is the most effective treatment for COPD?
It can be, but it's not alone. All that education and lifestyle modification is very important, but we put that in conjunction with various medications that can help.
So let's talk about some other treatment options. When do doctors usually recommend oxygen therapy, and what does oxygen therapy involve?
Well, when your oxygen gets too low, it can cause a variety of issues. And so doctors are going to want to monitor your oxygen each time you come in for an appointment. And when you start to discover that you can't walk from the parking lot into the doctor's office, or you can't do the things you want to do without your oxygen getting quite low, the doctor will talk to you about oxygen therapy. Not all patients need oxygen all the time, though. Some patients only need oxygen when they're doing certain activities, or some only need it when they're sleeping. And so oxygen therapy will be very individualized based on the patient's symptoms.
Are there pros and cons to using oxygen therapy?
Absolutely. Patients do find that when they have supplemental oxygen, when they need it, it can be life-changing because all of a sudden they have something to help with that shortness of breath. When they're better oxygenated, they can think more clearly, and their heart rate is slower, so they feel better on oxygen. However, the cons is that some patients really feel embarrassed to go out in public with their oxygen, or if they don't have a portable oxygen tank, they feel very tethered to their homes, and it causes some social isolation.
Let's talk about medications. Prescription medications, obviously those are available to treat COPD. Can you tell us a little bit about those?
Sure. So there are a variety of medications that we're going to use to treat COPD, and it's very individualized based on your symptoms. Some of the most common are various inhalers, and these inhalers, to start with, we talk about bronchodilators. And a bronchodilator is a medication that's going to help relax those airways and make them a little bit more open so air can come in and out easier. And people are familiar with these medications. You may have heard of albuterol, a ProAir, or a Ventolin inhaler.
Great.
There's also long-acting bronchodilators, and those are more like Spiriva, and some of those longer-acting ones, those are inhalers that you take just once a day, and instead of the short-acting ones that you take just as needed for symptoms. We also have inhalers that have steroids in them, and those steroids also provide some long-acting anti-inflammatory properties that can help improve lung function. And some patients actually have to take oral steroids as well, and that means in a pill form.
That was a great overview. Is surgery ever an option for patients?
It can be, certainly. We can do some treatments, such as lung capacity surgery, where we can remove part of the lung. In emphysema, when those air sacs are so large and we're trapping air, we can remove that part of the lung that's diseased and give more room for healthy lung to be there. It's not a terribly common surgery, but it is an option. And another option is lung transplant, but that takes some very specific criteria. Patients can't be still smoking, and there's a lot of testing involved to make sure that they're healthy enough to accept a new lung and healthy enough to keep that lung.
Becky, thank you so much. That was great information you shared with us today.
Mm-hmm.
And thank you for watching. Come back again next week. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.